as I preempted, we'll be having a conversation with the president of the Trinidad and Tobago Regional Registered Nurses Association, Mr. Idi Stuart. Good morning. He's with us virtually.
Pleasant morning to you and your listeners. Thanks for having me.
Okay, okay. It's always a pleasure to have you to give us the update in terms of the nursing fraternity. I know you're a man basically advocate for what you believe should be justice for the nurses in Trinidad and Tobago. But one particular issue you raised that I think it was at the launch of the Nurses Credit Union, you highlighted some figures presented by the Ministry of Health, which shows a high failure rate in the examinations of nurses. Tell us about that.
Yes, it is a major concern for the association when comparison was made between Trinidad and Tobago pass rate compared to our regional counterparts. And really and truly, we did not even need to be told of that information to know that that information has severe problems for our nation's healthcare system. Because internationally, and I will just back up a bit, internationally, the pass rate for nursing licensure exam, so while you would have your individual nursing schools doing their exams and the students will graduate with their degree in nursing, you still have to do a qualifying exam. So it's no different. The entire Caribbean currently does the RNR exam, regional nursing exam. And then internationally, if you go, you'll hear about the NCLEX exam you'll have to do, or the UK or anywhere else, you have to do their regional exam to be able to practice the profession of nursing. And internationally, the pass rate hovers around 80 to 90%. Some countries are doing exceptionally well, like Dominica, hitting 100%. Unfortunately, in Trinidad and Tobago, we are seeing a continued downward spiral of our pass rate, hovering around 50%. Now, multiple factors are at play. We are thankful that since making the clarion call, we have witnessed both the Minister of Health, Dr. Lakran Bodo, we have witnessed the new Minister of Tertiary Education, Dr. Prakash Prasad, making the statement that they're going to investigate this, they're going to listen to stakeholders, and they're going to address this downward spiral. So we are thankful for that. And indeed, we are also planning to meet with the Minister of Health on Monday. A meeting has been secured where we will be raising some of our ideas on how we can stem this tide.
Okay,
Um, mhm.
I saw a report with you basically highlighting some of the reasons for this failure rate. I know we would look at examinations and we would think, okay, it's just based on academics and just based on answering certain questions, you would hope that these students can pass. But you pointed to the stipend situation, you pointed to hostels and so on at the hospitals. These are factors that you believe are impacting the examination results of these students?
Yes, definitely. So let me just paint a picture from 20 years ago when I trained to present day 2025. 20 years ago, we enjoyed a pass rate. There were two nursing schools at the time, the Ministry of Health Nursing School and COSTAT. During that time, if you lived far from the medical institution you were training in, whether it's San Fernando, Port of Spain, San Grande, you had the opportunity, the benefit to remain right on campus, as it were, because there were nursing hostels available. And that is a practice that is seen regionally and internationally. Nurses remain right within the facility because of the time it takes. to get your experiences in. You may not be able to do it within the normal 8 to 4 period because there are so many things going on and whatnot. So you would generally wait late in the evening when it's not so crowded, not so busy, not so many things going on, not so many relatives present, and you would do your skills, you would develop your skills later in the evening. And but if you are living, think about if you're living Manzanilla, Sandy Grande, and you have to be traveling back and forth, you would not be able to remain these long hours. So we had that opportunity to remain in these nursing hostels, just like the doctors had their hostels, just like police, army, fire, prisons have their hostels where they remain and they don't need to go back and forth, thereby incurring further cost to someone who is not generating an income as yet. So generally, these professions, these areas of study generally require the person to remain in house. Now, today, hostels are no more. They have knocked down these hostels, they have abandoned these hostels to make way for car parks within hospitals. So that's one. Secondly, in my day, we had a nursing stipend, small as it were, but it used to be able to sustain us, to assist with food, assist with traveling expenses, because it's not only in that institution you train, you have to go to health centers, you have to go up to Cora, you have to go to labor wards. So you are required to travel. In today's date, stipend is no more. Yes, only one nursing school currently gets stipend, that's Costard. The other two nursing schools, UE and USC, don't benefit from stipend. So the students are now required to go and get a job to supplement their income because, as we know, we live in an economy where probably before parents could have sustained their children course of study. Now it is not so. So, in addition to the parents being unable to sustain their children, expensive course of study because nursing is expensive. The books cost $600-700. Stethoscope, uniform. So there are a number of things going to um, nursing. And if you don't have that stipend to supplement your daily activities, you could only understand the severe impact. And in fact, during my time, there were about 95% pass rate generally. And the 5% that would have failed was the 5% who had to go out and work. Yes. So generally, you would not see persons in medicine, persons in nursing. You would not see that regionally or internationally, those persons having a part-time job. It
Okay.
just doesn't happen because of the volume of work that is required to be retained and internalized and be able to practice something that can save someone's life or unfortunately cause that mortality and morbidity to
Mr. Stewart,
increase if you don't get the required training. Mhm.
Mr. Stewart, just for some context, looking at, you mentioned 3 schools in Trinidad and Tobago. Give me a sense as to how many schools? Is it really 3? Is it more than 3? And also, is there a situation where a number of the students are opting to go abroad or regionally to do their studies as opposed to the situation in Trinidad and Tobago? Because some may ask if apart from the factors that you mentioned with the stipend and the lack of hostels and or the hostels not being available and so on, but some may question the curriculum or even the senior nurses or lecturers' ability to enhance the performance levels. Tell us about the numbers in terms of the institutions in Trinidad and Tobago and add some context in terms of what is happening in terms of students deciding to study locally as opposed to going regionally and abroad.
Um, well, first to begin, there are 3 nursing schools currently: COSTAT, USC, University of the Southern Caribbean, and UE, University of the West Indies. 3 nursing schools. You also, and most of them, well, COSTAT and USC both have a North campus and a South campus. UE just has one campus which is stationed in the Couva Children's Hospital. So those are the nursing schools. We had a fourth nursing school up until last year. However, that nursing school came to an end, and the students and staff were transferred over to Costat. Reason being, it was operating illegally outside of the laws of Trinidad and Tobago, and ironically, it was run by the very government under the Ministry of Education. So because the law as it stands, all post-secondary and tertiary level education facilities must be registered with the Accreditation Council of Trinidad and Tobago to ensure that ACT monitors your institution and that you deliver the quality of education that the students who are coming into your institution deserves, and ensure that the public who is receiving care from persons coming out of your schools are at an acceptable standard. They can be comforted. So that's the first point. So that was closed down. And that is something that the association had been lobbying for, because we want to ensure all nursing students attend registered and approved schools. Secondly, next point, majority of nursing students in Trinidad, well, there's no statistics I could probably point to indicate how many students going abroad to study. That is something that I can't quantify how many persons. It's not something that information won't come to us. Because persons can go abroad to do any study, but we may not be aware of that. But generally, the nursing schools in Trinidad are definitely oversubscribed, so much so when they put out an ad for a new intake, they generally don't have to put out an ad for the following year, because there are so many persons applying that they can take in a batch now and then take in a next batch the following year without even going back out to advertise for new persons. So it's heavily oversubscribed now, and we have seen that actually since the pandemic, and I dare say since nursing has become more vocal, more and more persons are coming into nursing, and it's good, because it's now persons are seeing nursing as an option, a real option, a tangible option for employment, and it's definitely employment that you can get both locally, regionally, and internationally. Uh, Other programs of study would not get you that job assurance that you can get in nursing for sure. So it's definitely a profession where you can work anywhere in the world once you are qualified, once you pass the nursing licensure exam in that country.
Okay,
Um, mhm.
okay, and as you mentioned, employment, I understand that the nurses today are still functioning with 2013 salaries. What's the latest in terms of the
Yes,
salary negotiations? I know the former Prime Minister, Mr. Stuart Young, would have
yes.
called on a commencement of those talks. And I know you mentioned earlier on in the interview that you reached out to the new Minister of Health. What is the latest with the salary negotiations and advancement of those conversations?
Well, the salary negotiations continue since the announcement by the outgoing Prime Minister, Honorable Stuart Young. It continues. Currently, we are conducting negotiations with the ERHA because they were given specific directives to begin negotiation with the association under the last government. However, they have indicated to us, because we specifically asked, has the new and incoming Minister of Finance given any firm commitment to continue negotiations? And they have indicated they have not yet received any communication from the new Minister of Finance like they did previously. So again, we would be seeking, well, we already have a meeting confirmed with the Minister of Health. So we'll be following up to make sure that there's no delay in negotiations for nursing and midwifery personnel. And we have already signaled, even prior to this new government, that 2025 would not elapse without nursing and midwifery personnel receiving an increasing salary. It's really unacceptable that we continue to work in 2025 on 2013 salaries. And mind you, those 2013 salaries are not even being paid by some of the authorities, because generally you have increments that you occur every year, small amounts like $200, but it builds up, which some RHAs are very tardy on paying our members. So it's really a bone of contention that even on these 2013 salaries, nursing personnel, we still have to take a number of the RHAs to court, to the industrial court, for failure to pay these 2013 salaries at the correct level. In addition, we still have the issue of a number of temporary forms of employment. For the most part, it has been corrected in Southwest, in NCRHA, for the most part, but we still have a number of RHAs having way too many of our nursing personnel working still on temporary contracts, even though the past government would have given the commitment to rectify that situation. And just reminding persons, when you're on temporary employment within the RHAs, you do not enjoy a pension, you do not enjoy gratuity. So when you come to the end of your tenure, they are just going to say thank you and you go off. You don't have any pension to get. And because you have been working in the RHAs, you also not qualifying for the normal old age pension, as it were. So you are destined to a life of destitution as a nurse in Trinidad and Tobago if you continue to work on those temporary forms of employment.
Okay, and Mr. Stuart, before we close this morning, in terms of the launch of the credit union, this is the first of its kind, the credit union for registered nurses. Correct me in terms of the actual name
Yes.
of the credit union, but is it the first of its
So
kind, and
it's
what is the main role and function?
so it's the National Nurses Credit Union Cooperative Society. It's the first of its kind in Trinidad and Tobago, and it is targeting exclusively nursing and midwifery personnel who work within the RHAs or in the private sector, but you must be one of the nursing and midwifery personnel, registered nurses, registered mental nurses, patient care assistant, enrolled nursing assistant, etc. So it's closed, a closed bond. It is not open to anyone else except those persons. And it was really designed for, and we saw the need for it when nursing and midwifery personnel, because they work on these very poor salaries, because their tenure is 1 year contracts and 2 year contracts, while the association continues to be lobbying government to correct these shortcomings, we sought to do something on our own, which is to create our own financial institution to be able to fill that gap that has been left, that void that is currently present when nursing and midwifery personnel cannot go to a normal financial institution and benefit from loans, what have you. Because the financial institutions, as you would know, you go into a 1 year contract, they only want to give you a loan for that that would have to be paid back within that 1 year. So, look, we say we know most likely the jobs are secured. We will give you the loan at the Nurses Credit Union for an extended period, because we know nurses job, you can get a job anywhere.
Okay,
So that is what is really the purpose, to fill that gap.
okay, congratulations, and of course, I guess we hope that the nurses can tap into this new opportunity, this new access to getting, as you mentioned, loans and getting that kind of support. And we hope that that failure rate is better next time around. Very disappointed when we heard the news, and we wanted to make sure to have that conversation with you to shed some light on some of the issues that would have probably led to that failure rate as compared to our regional partners. I want to thank you for speaking with us this morning. Idi Stuart, ladies and gentlemen, the president of the Trinidad and Tobago Registered Nurses Association. Do have a good day, sir.